Good afternoon, everyone, and thank you for joining us for this pre-application webinar on PAR-22-33, which is the funding opportunity announcement for time-sensitive opportunities for health research. My name is Sarika Parasuraman, and I am a health science policy analyst in the Office of Behavioral and Social Science Research at the NIH, and I'm joined by, as primary presenters, Dr. Mark Rubert, a scientific review officer within the NIH Center for Scientific Review. Next slide, please. We're also joined by a number of program officers who are in attendance. The individuals listed on this slide are the main points of contact for those institutes that are officially participating in this funding opportunity announcement. Next slide, please. And so just a couple of quick housekeeping items before we get started, tips for this webinar. So all participants will be in listening mode and will not be able to ask questions verbally or use the chat function. Well, although I see one chat that has come through. Participants must, we're asking participants to ask questions via the Q&A feature. Questions will be answered during the Q&A session at the end of the webinar as time permits, but we should have plenty of time to answer everyone's questions. And then the slides and the recording of today's webinar will be available on the OBSSR website. It will be inserted here where it's highlighted, and that will be distributed widely. So you will be able to find the link and the resources from today. Next slide, please. Okay, so in this pre-application webinar, we will be covering the following agenda items. So number one is going through the PAR background, objectives, and expectations. Second, Dr. Rubert will cover the peer review process. Number three, we'll present the timeline for submission, review, and selection of applications. And then finally, we'll close out by answering all of your questions that you have. Next slide, please. Okay, part one, background, objectives, and expectations. Next slide, please. So the purpose of this funding opportunity announcement, or FOA, is to establish an accelerated review and award process to support research to understand health outcomes related to an unexpected and or time-sensitive event. So for example, like an emerging environmental threat, pandemic, a change in local, state, or national policy, or even like a natural disaster. Applications in response to this FOA must demonstrate that the research proposed is time sensitive and must be initiated with minimum delay in order due to a limited window of opportunity to collect baseline data, to answer key research questions, or prospectively evaluate a new policy or program that might have an impact on health-related behavior or health outcomes in a given population. And so I want to underscore these points because this is really a distinguishing feature of this funding opportunity announcement and one that we will be emphasizing heavily throughout this webinar. Next slide, please. So just a couple of key definitions for this FOA. An event is a unique and often unanticipated issue that arises in a particular community or population due to emerging environmental threats, other public health threats, disaster events, or policy changes. A policy, this includes both formal public policies at local, state, and federal levels of government, as well as organization level policies, such as those implemented by large organizations, work sites, or even like school districts. A program is a set of activities such as implementation of system-level interventions, tools, or guidelines that are initiated by both governmental or other organizational bodies within public or private entities in local, state, or federal jurisdictions. And then finally, infrastructure changes. These are considered alterations to the built environment, such as housing, roads, and other aspects of transportation systems, retail environments, and building of parks or green spaces. Next slide, please. So this funding opportunity announcement is intended to support research and data collection opportunities for unanticipated real-world events. In other words, those that occur outside of a laboratory or other controlled setting for research purposes. And these events are ones that have limited windows of opportunity for planning and conducting rigorous research and data collection. These are also opportunities in which empirical study could really only be available through expedited review and funding, truly necessitating a substantially shorter process than the typical NIH grant review and award cycle. And again, want to emphasize that these are research opportunities that really go beyond simply being just an important and urgent public health topic. Um, um, this FOA encourages partnerships and collaboration between researchers and the impacted community, which may include the following types of entities as appropriate, right? So community-based organizations, local and state governments, private or nonprofit organizations, behavioral health or healthcare systems, individual healthcare providers, departments of health, community health clinics, juvenile or criminal justice settings, schools, and even child welfare systems. So this, also we encourage research that has the potential to be generalizable beyond a particular locality, that is a region, community, or other defined geographic area, and generalizable also to populations. And then finally, proposed studies are encouraged to demonstrate the ability to inform the understanding of the impact of the event, policy, program, or infrastructure change in the near term. Next slide, please. Okay, so this slide and then the one that follows, again, are really ones that we want to emphasize for this particular funding opportunity. So the distinguishing features of what is considered a responsive study for this FOA are, number one, the unpredictable and unanticipated nature of the research opportunity. Number two, the clear scientific value and feasibility of the study. Number three, having a feasible plan for the collection of baseline data and primary data collection. Although the use of existing data or secondary data is allowed, really having a solid plan for collecting important and new data rapidly, this should be provided. And then number four, a justification for why an expedited review and funding, in other words, one that is substantially shorter than the typical NIH grant review and award cycle, why this expedited review and funding is required in order for your scientific questions to be addressed and the research design to be implemented. So applicants are encouraged to consider or include a number of things. So for study methodologies such as like interrupted time series, difference in difference designs, regression discontinuity, or propensity scoring. Methodological developments and approaches for strengthening causal inference from evaluation of these quote unquote natural experiments or observational study designs. And then secondary implementation related outcomes that could inform interpretation of outcomes for future researchers and decision makers, such as unintended consequences or barriers and facilitators associated with implementation. We also encourage applicants to review past NIH-led efforts that have, collated research strategies for ensuring study rigor and reducing bias in this type of work. For example, including an appropriate comparison group where possible. And the link to the NIH Pathways to Prevention P2P workshop work is included here, as well as in the FOA. Next slide, please. Okay, and then, again, the following types of applications are considered not responsive to this FOA. So first is applications that do not explicitly justify the time sensitivity, of the proposed work, the urgent need for data collection, and the need for an expedited review timeline. Applications that propose to use qualitative data exclusively, although mixed methods approaches are encouraged. Applications that propose to conduct analyses of existing data exclusively, unless allowed in IC specific interests, and we will get to those in a couple of slides. Applications aimed at addressing unanticipated needs or additional aims for an existing study. In other words, proposing to expand an existing study. Applications proposing to use animals, pets, laboratory animals, or wildlife as surrogates for human health or exposure. Applications where the program director or the principal investigator of the evaluation study application is the director and or initiator of the policy, program, or infrastructure change that will be evaluated. And then finally, applications that independently propose initiation or delivery of new policies or programs. And so, again, another point that we want to, double underline, highlight, underscore. It is strongly recommended that you reach out to the relevant program officer specific to your specific topical area prior to submission of your application, because again, non-responsive applications will not be reviewed. Next slide, please. So a little bit of the brass tacks of kind of the structure of this particular mechanism. This is an R61, R33. This is a two-phased milestone-driven grant mechanism. So the first part is the R61 phase. This will support developmental exploratory research activities, IRB approval for human subjects protection, further development of study partnerships, and the collection of baseline data for up to 1 year. And then the second phase is the R33 phase. This is for up to 4 years. This is during this phase, we expect to see expanded activities designed to achieve your full research aims. They may include further development, application, follow-up data collection, or implementation as appropriate and relevant to your proposed research questions. So, as you transition from the R61 to R33 phase and just, sort of as you think about how to structure your application, there are several expectations that we have. So applications should articulate clear aims and objectives for each phase of the proposed research with specific discussion of how the results from your first R61 phase will inform the R33 phase. Applications must delineate explicit milestones for the R61 and R33 phases. Here, a milestone is defined as a scheduled event in the project timeline that indicates completion or accomplishment of a project stage or activity. It is expected that baseline data collection will be conducted within 6 months of the award, as is appropriate for an expedited mechanism of this nature. And this should be included in the applicant's submission of your project timeline and your milestones. And then at the completion of the R61 phase, the PD or the PI will submit a report that includes the progress on each of the milestones and a clear description of how research during your first R33 phase or your second will be impacted by attainment of the R61 milestones. Determination of continuation onto the R33 will depend on the PO's review of your report with regard to preliminary research results and achievement of your milestones, as well as availability of funds and program priorities, irrespective of milestone achievements. Next slide, please. And so additional considerations that we're required to mention, transition to the R33 phase is neither automatic nor guaranteed. Funding for the R33 phase is subject to availability of funds and program priorities, again, independent of milestone achievement. And given the possibility for changes in policy or program implementation that may be beyond the control of the grantee, grant awards could be terminated early if these changes limit the possibility to collect meaningful outcome data. And so, again, number one, outreach to program officers. Applicants are strongly encouraged to contact your relevant scientific contacts, those who are listed in the funding opportunity, to discuss whether your application would likely be considered responsive based on, time sensitivity, roughly, 4 weeks in advance of when you are planning to submit your application. The second point, the letter of intent. So a letter of intent is not required. It's not binding. It does not enter into the review of your application, but the information that it contains is very helpful for IC staff, institute center staff to estimate the potential review workload and plan for review. Further information on what to include in the letter of intent may be found in the funding opportunity. Next slide, please. Okay, so the next several slides include specific research areas of interest for our participating institutes. These also appear word for word as they appear on the slide here in the funding opportunity announcement. And so I won't go through every bullet because it's a lot of really great information. But as you are preparing your applications, again, we encourage you to reach out to IC specific contacts for specific questions related to a certain or topical area that aligns with these bullets. If you need more general guidance or aren't sure who the best person to contact is, please don't hesitate to reach out to me. My contact information is listed within the funding opportunity announcement. And so I will sort of very quickly breeze through the next couple of slides. So we've got specific topic related areas of interest from NCI. Next slide, please. NICHD, next slide. NIDA, you can sort of slowly go through NIMHD, next slide. We've got NINR, NIAAA, and NIAMS. And I believe the next one is the offices. Okay, 1 second. So we've got 3 offices that are officially included in this FOA, and I think this is important to mention that NIH offices, we don't manage or administer grants. Applicants are again encouraged to focus your applications on the objectives of at least one of the participating ICs listed in the announcement. Offices listed may consider opportunities to co-fund projects, but these requests really originate within, from NIH program officers themselves. But anyway, the offices that are, officially included in this FOA are OBSSR, the Office of Disease Prevention, ODP, and ORWH, the Office of Research on Women's Health. And there are, specific kind of areas of interest that are listed here and also in the FOA as well. Next slide. Okay, I'll turn it over to Dr. Rubert now for part 2 to discuss the peer review process.
Thank you. Mark Rubert from the Center for Scientific Review. I'm going to talk a little bit about the peer review process today. Next slide, please. Next slide. So this is not an R01 application, so I'm basically going to highlight the difference between our sort of bread and butter R01 reviews and this R61, R33 review. I will not spend a great deal of time on this as Sharika has already given you the detail on this, but you can see that it is a 1-year/4-year award. And more particularly, the application should articulate clear aims and objectives for each phase of the proposed research. And we need you to delineate explicit milestones for the R61 and R33 phases. Next slide, please. On this slide and the following slide, I've tried to highlight those things that are not typical for the R01 review, but are specific to this review. So you can see here where we have the section for overall impact, where we want to see if your application will exert a sustained and powerful influence on the research fields, but we also get to consider the following criteria, which are highlighted below. As is usual for an R01, we look at significance, particularly does the project address an important issue in the field? Is it rigorous? And will it, when you complete it, change the field in some important way? Next slide, please. As usual, we will look at investigators. Is the team, particularly the PI and other members of the team, well suited to the performance of the proposed project? And we will move on to innovation. Not all projects will be innovative, but those that are, do they challenge existing research or practice in some important way? Next slide, please. The approach will be as usual for an R01, and we are looking, of course, at strategy, methodology, and analyses. We look at the approach in great detail, and while some of the early stage studies in the R61, we'll have to look at feasibility and acceptability, I'm sure, of those studies. And of course, if you have vertebrate animals or human subjects, you must address relevant biological variables such as sex. For the R61 part and the R33 review for this particular PAR, we will be asking, is there a unifying research question that transcends both the R61 and R33 phases? As we've mentioned several times, we'll be looking for those milestones. Are the milestones well specified? Are the milestones conducive to establishing the study aims? Will be questions for the reviewers to evaluate. We'll be looking at the phase-based goals of the R33 and whether or not the R61 findings are used. And of course, as Sharika mentioned before, there is a 6-month piece that we're expected to evaluate as well. Next slide, please. Environment will be as usual, particularly looking at institutional support and whether or not there are adequate equipment in the scientific environment to contribute to a probability of success. If you're proposing opportunities outside of the US, which we often evaluate, is there appropriate justification provided for how the information obtained will have direct implications for US practice and or policy? As we note down here, again, we're looking at human subject concerns, both domestic and international, to be addressed within the timeframes of the award. Next slide. These will not be considered as part of the overall score in terms of individual scores, but they are considered in obtaining the overall impact score, which will be, of course, the usual protection of human subjects with the 4 elements. And we will be looking at inclusivity of women, minorities, and individuals across the lifespan for all human subject-oriented research. And of course, if they include vertebrate animals or biohazards, those will also be evaluated and may be considered as part of the overall impact score. Next slide. These are some additional considerations. As I say, we will not give scores. The reviewers will not be asked for scores, and they will not be considered in the overall impact score, but reviewers will be asked, it appears in a binary fashion, did you demonstrate the time sensitivity of your research opportunity? And it must be clear that the proposed study is time sensitive. And finally, the reviewers will be asked to determine whether or not the event described in the application offers an uncommon and scientifically compelling opportunity that might be only available through this mechanism. So again, those appear to be a series of questions we will answer and then give to program. Next slide. We expect to review all of these applications within a special emphasis panel, which means the reviewers will be recruited specifically for the applications that we receive. All conflicts for the applications will be excluded during the review of any application for which conflict exists. And standard NIH review procedures will be used. Every application will receive a written critique, or what we call a summary statement. Next slide, please. For those of you who are not aware, the NIH scale for scoring applications is 1 to 9, with 1 being the best score. During the review of an application, all eligible reviewers, i.e. those that are not in conflict on the panel, will give an overall score for each discussed application. The average score is then multiplied by 10, rounded to the nearest integer, giving us whole probability scores from 10 to 90, with 10 therefore being the best possible overall score. About half of the applications are typically not discussed, and they do not receive priority scores. They do, however, receive full written critiques, i.e. those summary statements that we talked about before. Next slide, please. If you have specific questions about the review for these applications, here's my contact information. Email is usually the best. Thank you, and back to Sharika.
Thanks, Mark. Awesome. Okay. So part 3 will be covering the timeline for submission, review, and selection of applications. Next slide, please. Okay, so just a couple of key dates to highlight. These are also, of course, listed in the FOA as well. So the funding opportunity announcement was officially posted on September 1st of this year, 2022, with the open date being November 1st, 2022. This is the first date that applications can be received. The letter of intent due date, again, not required, but highly recommended that it is submitted 4 weeks prior to the application due date, or when you plan to submit your application. Applications are accepted on a rolling basis. With the peer review meeting, the goal is for applications to be reviewed within 8 weeks. Council review will also be expedited. And then the earliest start date would be for awarded applications would be within 4 to 6 months of application receipt. Next slide, please. Okay, and then here are listed just, again, the folks that you want to reach out to for your topic specific questions. They are the primary points of contact from each of the participating ICOs. Next slide. Okay, so we have reached the Q&A portion of the webinar. We'll address we had a handful of pre-submitted questions we received prior to the webinar. So, I'll address a couple of those, and then I will be handing off the Q&A portion to my colleague in OBSSR, Dr. Dara Blackman-Demner, to monitor. She has been monitoring the Q&A submissions, and we will also invite our PO colleagues to contribute as well. So just as a reminder, this is really for questions that are high level and broadly applicable. If you have specific questions for your topical area, we encourage you to reach out after this webinar. Okay, so the first submitted or pre-submitted question that we received was with regard to the listed receipt date of November 1st. And as stated, this is a rolling deadline. This is a unique feature of this particular mechanism, which means that applications will be reviewed as they come in, essentially, before, or they'll be examined as they come in before moving on to review, so long as they are responsive to the FOA. The second question we received was with regard to partnerships and how to properly include them within the R61 portion of the mechanism for budgeting and planning purposes. And what we would say here is that the FOA does encourage partnerships as important for this type of work. Partnerships should be incorporated into your proposal and budget as properly reflective of their roles, their responsibilities, and their contribution to your work. And again, just want to highlight that there is flexibility within the current FOA parameters. So hopefully that addresses that question. And that's all I've got. So Dara, I'll kick it over to you now.
Sure. And again, just a reminder to everyone, please place your questions in the Q&A, and you also, some of them will be answered by typing, and we'll try to get as many of them answered live as we can. Before I jump into these questions, I just want to give an opportunity if any of the program staff want to add anything to the few questions that Sarika just addressed in terms of partnerships or anything else. If not, we'll jump into some of the other questions. Okay. All right, so I'll just throw out these questions. And again, anyone feel free to speak up. And I know sometimes it can be helpful to hear from a couple of different folks because, ICs have slightly different perspectives on some of these things. So let's see, the first question is, does the R61 need to be a full year if much of the planning work would already be done? And I think a related question about the sort of the 6-month time frame. And this is something that we actually, I'm not sure, made completely clear, but for the primary data collection, does in terms of that 6-month period, does the data collection need to be completed within the first 6 months or started within the first 6 months? So I will put that, both of those kind of time frame questions to my colleagues. So the first one, just a reminder, does the R61 need to be a full year if a lot of the planning is already done?
You've got a quiet group, so I'll
Yeah,
jump in here.
so I will jump in then, or Sarika. I mean, I would say no. I mean, I think it's up to a year. I mean, these are, you know, the ideas for these to be sort of quick turnarounds. So yeah, if you don't need a year, then I think that you know, just plan accordingly in the submission. If others disagree or have additional thoughts, please feel free to jump in.
Thank you for saying that, Dara. I was going to say something similar. And I guess you asked the question about about data being collected. I guess the key point, again, as you have both mentioned, is what opportunity is lost if you don't start data collection at that time period. So if there's something lost by waiting and not, it may go on beyond the 6 months, but what opportunity are you missing or losing by not starting at that time point, I think is something to consider. And again, that importance may vary by research question.
Absolutely. Thanks, Marissa. Any other thoughts on that time frame, either of those time frame questions?
I guess I'll just add again, as you have both mentioned, we're all happy to chat with anyone interested in applying. So if it's something you're not sure about for your particular question, feel free to reach out and get further clarification as well.
Okay.
And hopefully that addresses the question that just came in. Is it okay to collect data during the R61 period?
Right.
Yeah.
Okay. So the next question is, can investigators propose a dissemination aim? For example, 1 to 2 research aims to study the impact of the event or policy, and another aim focused on dissemination of results to impacted communities. Any thoughts on that?
I think this would need to be, you have to look at the individual project and remember that there is a limited amount of time when you've already got an R61 phase that's taking some of your time. So I think that it might be allowable, but that's one of those things where I most definitely would talk to a program officer about your specific project.
Thanks, Karen. Any other thoughts about dissemination aims for this type of work? Okay, we have a number of questions about the review process, not surprising because it is a little bit different than usual. So I'll pose these and Mark, you know, I'll turn them over to you, and others, I guess, can chime in with. So essentially, I think people are a little bit wanting a little bit more clarification about sort of how these rolling deadlines will work, how study section participants will be put together. Oh, I see. You've already said you're going to answer that one.
Yeah.
So why don't you start there, and then I'll throw some of the other ones at you. Great.
Well, that one's fine. You can throw that one. So rolling deadlines are always a bit tricky. I'm not sure we'll see how rolling this one is because we've done rolling deadlines before and then people don't submit in that fashion. They tend to submit in clusters. So as usual, it will be gathering as many applications as we can within the time frame available to meet the 8-week deadline. So we won't really know how many applications we're going to review until we get them. And then we will try to pile them in. How will study section participants be selected? They will be selected based on the research aims of the applications that are submitted. We go over the specific aims and the methodologies and try to acquire adequate expertise to review that application fairly and thoroughly. I will remind you that the review is always based on the willingness of people to review. I can pick the perfect people to review, but I can't make them say yes. Do you want me to do letters of support? That's
Sure. That would be great. Thank you.
so in general, reviewers love to see letters of support, proving that you do have those partnerships in hand. Obviously, with the timelines involved, that may be difficult to do for these applications, but I would say to the extent that you can, it would likely be appreciated, though I think the reviewers will be understanding in some cases. But if it's a primary partner that you've been working with forever, yeah, you should be able to get a letter of support from them. So I don't know what other ones you
Okay,
saw.
yeah, I think that will the review committee meet about every 8 weeks to review accumulated submissions? And I mean, we sort of answered that already. So
Yeah.
unless we have anything else we want to, okay, great. I will let you know if any others come in for review. We have another question about multi-institutional or multi-institution or multi-PI, I'm assuming is what they mean. Are those types of proposals encouraged? Any thoughts on that from our program officers? I suspect that's also one of those things that, you know, it really just depends. I don't think it's necessarily encouraged or discouraged. I think it really just depends on the research question and the, you know, if it makes sense for the group of institutions to come together to answer the proposed research question, then absolutely, but it's certainly not necessary.
I would agree.
Okay, thank you. Okay. Let's see. Here's another question. Many of these events happen so quickly and unexpectedly that there's no opportunity to collect baseline data, such as with hurricane. How will the extent to which the project collects data at a true baseline be considered? So I know that's something we discussed a lot in the planning for this. So it would be great if we can have a couple of perspectives on that.
I think one of the important things is, again, this is going to be dependent on your question and what it is that you're trying to show. So with a sudden event like the hurricane, most of these time-sensitive events are actually sudden events in one way or another. Certainly using existing baseline data makes sense. Sometimes that's not available. So then I think you have to be careful in how you aim your research question so that it's going to be possible for you to address that with the data that you can collect.
Thanks, Karen. Any other thoughts or reactions to that point? Certainly an important one to be thinking about.
Yeah, I would say that I think, you know, it really probably depends on the type of event that you're responding to. If there's a policy change that is anticipated and you know it's happening in 6 months, then perhaps you will be able to have the opportunity to collect baseline data before that policy change happens. But of course, with things like disasters, those are truly unanticipated and that you don't know that they're coming. And most likely your baseline will be more of a baseline that is close to after the event, and then maybe you're looking at the long-term effects of a disaster versus the immediate impacts of a disaster, for example. So yeah, I think it will affect the framing of the research question, but I don't think that you know, one would be faulted for not being able to anticipate that a disaster was happening and collecting baseline data before it happened.
Great, thank you. Any other?
And you know, I can give an example. I'm coming from NIDA, so some of the unexpected events we deal with have to do with overdose and things like that. So there a lot of times it isn't expected that you will have necessarily some pre-data if we're looking at an overdose event, but this will allow researchers to get boots on the ground as quickly as possible. So perhaps they can work with community partners to really get services in place that will help prevent this in the future or address any of the needs from this particular event as quickly as possible. So it really, as my colleagues have said, it depends on the question. So so just make sure that whatever it is you're proposing just really makes sense for the outcomes and the outreach that you're looking for beyond it.
Great, thanks, Marcia. Sarika, I see I was going to go next to this question, but you want to go ahead and jump in about the question whether this FOA is including research regarding COVID, or if this is really supposed to be kind of moving away from COVID related.
Yeah, and it's one that I'm sure you could answer as well, but you know, we there's no expectation of that, but we would encourage you to make sure that your topical area aligns with the specific, you know, sort of bullets that have been provided by each of our ICO partners.
Right,
And
there
again,
oh,
reach out with any if there's any, you know, ambiguity or you want further clarification.
Yeah, and just keep in mind that there are still a number of ongoing and active funding opportunities that are COVID specific. So probably would be best to look at some of those. But yeah.
And if I can reiterate, even if it's something that's related to COVID, we should go back to the intent of what this is. And it's we want to make sure that it's research that cannot be conducted under a standard NIH timeline. So if you're unable to reach the aims, even if it's a COVID related question, we might take it in that sense. But if it's a COVID related question that can be conducted with a standard NIH timeline and you can achieve those aims, it wouldn't be appropriate for this mechanism. So keep that in mind. It's just, you know, COVID broadly doesn't cover it, but that's really the primary piece that I know Sarika mentioned a couple of times, but that's what I always come back to whenever I get asked whether something is appropriate.
Great. Okay. I see a question about expectations about funding the R61 versus the R33. I'm not 100% sure I understand the question, and I know people can't come off mute. So if whoever asked that wants to clarify, but I'm going to take a guess that they're talking about sort of, I mean, I think as Sarika said, you know, the R61 is funded and the R33 may or may not be funded. I mean, there's really no guarantee. We're funding the R61 as, you know, as the pilot to collect this data to see if it's feasible. And then depending on whether milestones are met, you know, availability of funds and continued relevance to IC priorities, the R33 may or may not be funded. So if that's what you're asking, then yeah, there's not any particular expectations about the R33 phase. The two phases. I think the budget information should be detailed in the FOA, but if you have specific questions, you can always follow up with your program officer. Thank you. Other thoughts about that? Okay. We have a question about page limits, which I have to admit, I actually don't know the answer to. I don't know if maybe one of my program colleagues does. If not, we can make sure that we include that in the FAQ document posted.
Actually, the FOA says that it follows the regular table of page limits. Okay. And according to that table, for an R61, R33, it is 12 pages.
Okay, wonderful. Thank you, Karen. I knew it was in there somewhere, so appreciate that. Okay, great. So it looks like we've gone through all the questions. I mean, we do have, you know, we do have a little bit more time if there are additional questions, or I'll see if any of the program staff or CSR staff have anything they want to add. Just a reminder, as Sarika mentioned, we will. You know, it will take some time, but we will eventually, as quickly as we can, get the recording, then the slides, as well as a FAQ document up on the OBSSR website, so you can follow up. Oh, a couple more coming in. Let's see. Okay, are there any efforts to apply an equity lens for the actual research team? Anybody want to respond to that? Ariel, do you want to start with that one?
Sure, I can try. I mean, I think that with regard to the research team, I think that it's not necessarily something that goes into the review process. Is the team diverse? I think that, you know, certain ICs, I mean, NIH has policies regarding funding of early stage investigators, which I think a lot of the time speaks towards equity. But yeah, I'm not sure what else to say about that unless anyone else wants to jump in there. Certainly, we encourage applications from diverse research teams.
Thank you. Anybody else want to jump in there? Okay. What pay line will be used to determine if the application will get funded? I'm going to push that to my colleagues because I know each IC is handling this differently. So if anyone wants to jump in.
Sure. So NIDA doesn't really have a set pay line, so we're the one that everyone struggles with. So this, you know, this will be reviewed through NIDA leadership and recommended for funding as we do everything else, and that has to do with programmatic priority and the merit review. So that's unfortunately all I have to say about that one. We're not going to have any funding lines for this specifically. We don't have a set aside for this particular FOA, so it will come in for in the same way that all other FOAs do, or all other applications to other FOAs that don't have a set aside, which is the majority of the science that we fund. So it'll just be about scientific merit and program priority. Another reason to reach out to program staff before you apply to make sure that it fits within priorities for us.
Thanks, Marcia. Anyone else from other ICs want to respond? And if not, we would just encourage you again, when you know, if you follow up, that might be a question you could ask the program officer at that time. But I do think each IC is going to be handling it differently in terms of set asides versus pay lines or other processes. And I do see the questions here about examples of previously funded topics. So this is a new opportunity. It's a new FOA that we're doing across NIH. However, there have been a number of ICs, some of whom are represented here, some of whom are not, who have done this with IC specific questions. And so I will let maybe Marcia or others can jump in and give some examples from the FOAs that they have done for their IC, but we can also make sure that we put the links to those previous funding opportunities in the FAQ, and you would be able to go in and into the NIH reporter and search by the FOA number and see examples of funded projects. And it's slightly different, this one, but it'll give you a little bit of a flavor for the kinds of projects that have been funded.
So I can speak to NIDA has had a time sensitive mechanism. It's an R21 for quite some time, and the topics obviously evolve as things happen. So the recent one, you'll see that our bullets for our research areas are very similar to what we have in the NIDA R21 set of topics. But for us, as I mentioned, things like overdose or things relating to drug policy or healthcare treatment policy that have to do with drug treatment I think that's when it originally started with ACA, and there were some changes to how drug treatment was being dealt with through ACA. And so that's kind of where we started doing it, and then realized that there were a couple of other topics that we might want to consider. At one point in the earlier iteration, we did have a very specific COVID related topic that we removed in a more recent iteration because we didn't want constant COVID applications. So it really is kind of what is happening. That's the purpose of this one, for the time sensitivity of it. So I guess that's it for that one.
Thanks, Marcia.
Hopefully I'm addressing the question correctly, but I guess another example of another time-sensitive opportunity that's currently active is there's a time-sensitive one for obesity policy and program evaluation. And I think that highlights an example of, there was a question about different pay lines depending on the IC. There's different answers to that, but that is an example of one that's been around and currently still active that one could look at, and happy to share the link with that.
Great. Thanks, Marissa. Do you happen to, off the top of your head, have maybe, I think they were asking for like specific examples of like the types of projects that would be funded. Do you happen to have any ideas of, not a specific project, but maybe just to give folks a flavor of the kinds of, I know school start times was a big one, if I recall.
Oh, gosh, I mean, this one, focusing on obesity policy. Yeah, I guess I'm trying to think off the top of my head right now. There are ones with changes in transportation, changes in like taxes for foods. So and by city, where they were going to implement the tax or program, and they were able to collect data before and after it went into effect. So sorry, it's very it ranges by IC. Happy to chat about NCI specific ones or connect people.
Yeah, that's fine. Thank you. Okay, I think we're maybe winding down. I don't see any more questions. So I will turn it back over to Sarika to close us out.
Sure. Thanks, Sarah. And thank you to all of our PO colleagues. Thank you to Dr. Rubert. So we've got sort of our general OBSSR contact information here. But again, highly encourage you with any questions at all. This is a unique mechanism. We're very excited about it. So we encourage you to reach out to us. Please don't hesitate with any questions. If you want to, you have a letter of intent, or you have, is this really responsive? We're always happy to help. And yeah, so thank you so much. I hope that this was helpful. Look out on the OBSSR website for the webinar resources and for these slides. And I guess that's a wrap. So happy Thursday, everyone.